friends, now that COVID-19 coronavirus is here already in India, so let's do the recap of do's and don'ts of what we should and what we should not to prevent this disease. Of course, all of you are now have already done completed PhDs with all the WhatsApp gyan about the COVID-19 and what we have to do. So let's pick up excerpts out of that and do to revise what we should and shouldn't, right? The first thing, of course, as everyone knows, is we should be washing our hands regularly. Now, remember, just set it in your mind that the moment you step out of the house, everything that you touch may have the virus, right? So even if you're touching a car handle, a metro rod, an auto handle, or even maybe just any surface, a desk, a table, anything, maybe somebody's shoulder, clothes, anything. So that may have potentially the virus. So what we have to do is the moment we reach our place, remember to wash your hands for a good 10 to 20 seconds. Make sure that your hands are very well washed with soap. Also, make sure that your tables are being wiped with a disinfectant. Make sure that you have an alcohol-based sanitizer. I'm using this, so you can pick up any alcohol-based sanitizers so that you're washing, so that you're sanitizing your hands, pumping your sanitizer and washing it. Especially if you need to scratch your face, scratch anywhere around the eyes, the nose, the mouth. They're the potential takers of the virus. So make sure that you're sanitizing before you touch any part, right? And that's one way of protection, which everybody knows. Just revising that. Another thing is if you are moving into an area where it's crowded, like for example metros or example buses, so make sure that you're using your mask. A simple surgical mask would do. You don't need the NH95, which everyone's saying. Just a simple one. Remember, just wear it like this and remove it from the ears. Do not touch the mask when you're removing it. Now this is basically because everyone knows it's a droplet infection, so that one, you are not going to scratch your nose and mouth once the mask is on. That's a reminder. And two, if somebody sneezes on you or somebody sort of coughs on you, at least you are safe. Now remember, it's a droplet. The symptoms of the COVID-19 is dry cough with fever, breathlessness or shortness of breath, and a lot of malaise and body ache. So there isn't much of cold and sneezing in this. So don't get scared if somebody sneezes on you, but be careful. Now, if you do have any kind of dry cough with shortness of breath and fever, isolate yourself for at least good 2 to 3 days. Just isolate yourself from the house. Make sure there's just one attendant who would probably be the youngest and the highest immunity person, so that you don't spread the disease in case you have it. But within 3 days, if you feel there's a lot of breathlessness, shortness of breath, or your fever is not coming in uncontrolled, then you can go to the hospital, get yourself diagnosed, and probably get admitted if you get positive. And of course, we have to increase our immunity. Indians are known for their immunities. Come on, girls and boys. We have to make sure, we have to show the world that we are having a good immunity. Up your vitamin C, take your citrus fruits, your amlas, or pick up a vitamin C tablet. Pick up, increase your vitamin D, because these are the things that are immunity boosters. Pick up echinacea tablets if you want, because they are all immunity boosters, especially for these kind of viruses. I can never pay more emphasis on meditation once again. Please do that 15-minute meditation. Connect to yourself. That increases your immunity also a lot. And sleep your 8 hours. And remember, be happy. That's one thing that will keep your immunity going, your endorphins going, and we'll be able to absolutely fight the coronavirus. Cheers to all the Indians, and we'll be absolutely fighting it good way.